right, I washed my hands and downed the appropriate PPE. Hi, my name is Francesca. I'll be your student nurse today and I'll be performing your physical assessment. How are you feeling today?
I'm feeling great, thanks for asking.
Good, and I closed the curtains and shut the door to ensure your privacy. Can I please take a look at your ID band? If you could state your full name and birth date.
My full name is Dwight Anthony Thane.
Okay.
My birthday is February 2nd, 1997.
Good, everything checks out. Okay, Dwight, and can you please tell me why you're here today and where are you?
This is a physical and I'm in Beaumont, Orlando.
Very good, and can you also tell me today's date?
Today's day is February 5th, 2021.
Awesome. Okay, and just a general inspection, I see that your skin color is appropriate for your race and your posture is upright. You looked well groomed, and your mobility coming into the room today, your gait was steady. Okay, so I'm going to go now to your upper extremities. So if you could just put your arms out for me. Good. Okay, so your arms look symmetrical, bilateral. No scarring or lesions or bruising that I see. And your skin color is appropriate for your race. Now I'm just gonna squeeze and just let me know if you feel any tenderness or pain. Okay?
No tenderness or pain.
Very good. Okay, and I felt no disformities either. Okay? And now I'm just going to check your hands. Your hands, okay? Skin is intact. Skin color is appropriate for your race. Moisture is appropriate. And no bruising, scarring, or lesions that I see. Okay, good. So I'm going to take 2 of your pulses now. So if you just flip your hand, I'm going to feel for your radial pulse. Good. So that is present, +2 bilateral. And now your brachial pulse up here. And that is also present, bilateral, +2. And I'm just going to feel right here. And just let me know if you feel any pain or tenderness.
No.
Good, and so no swelling in your epitrocular lymph nodes, okay? Good. And, okay, so back to your hands. I'm going to check just your capillary refill on both hands. All right, so refill is present, bilateral, with the refill being less than 2 seconds. So now if you could just take your 2 index fingers and put them together for me like this.
Like this?
Perfect. I'm just going to check for clubbing. Okay, good. So no clubbing of your fingers. Good. All right, so I'm done with this side. If you could just turn, I'm going to do your posterior, okay? All right, good. And, okay, so let me just check your back. Just observing it, your skin color is appropriate for your race. And skin is intact, no bruises that I see, lesions or scarring. And your shoulders are symmetrical, bilateral. Your scapular placement is even, spine midline, and your muscles are appropriate for your age, okay? And I'm just gonna do some palpation. Let me know if you feel any tenderness or pain.
No tenderness or pain.
Good, and I felt no bulges either, or disformities, okay? And now I'm gonna do your vocal fremitus, just feeling for vibration. So if you could just say 99 for me.
99.
Again.
99.
One more time.
99.
Perfect. Okay, so your vibration was equal bilateral. All right, and now I'm going to touch your lower back. If you could just take a deep breath in and out with your mouth open, please. Good, so your expansion is equal bilateral. Okay, and I'm going to tap gently now on the sides of your back. Just checking for, this is your SVA angle, okay? So let me know if you feel any tenderness or pain.
No, ma'am.
Good, so no SVA tenderness or pain that was present, okay? So I'm going to now listen to just your lungs, okay? So if you could just take a deep breath in and out with your mouth open, okay? Again. Okay, one more. Good, so lungs are clear to auscultation. And let me do your sides also, okay? So just same thing, deep breath. Okay, other side. All right, so lungs on the lateral side are clear to auscultation as well. Perfect. If I could just have you turn back around, I'm gonna take a look at the anterior part now, okay? So I'm just observing your skin looks intact and your skin color is appropriate for your race. No lesions, bruising, or scarring that I see. Your respiratory movement looks even and your breathing is unlabored. And I also see no pulsations or heaving on your precordium, okay? Good. So I'm going to do the same thing I did on your back with the 99, okay? Just checking the vocal fremitus. So say 99, please.
99.
Okay, one more.
99.
We'll do one more.
99.
Good. So vibrations are equal bilateral, okay? So I'm going to listen to your lung sounds now, okay? Take a deep breath with your mouth open again. Okay. Okay. So your lung sounds are clear to auscultation, okay? And now I'm going to listen to your heart sounds in 5 different locations. And on the last one, which is down here, I'm going to be listening for a full minute, okay? So you can just relax. All right, awesome. So your heart rhythm was regular, and your S1 and S2 was present. S3 and S4 was not present, and no murmurs were heard. And your apical rate was 84 beats per minute. Okay, good. So I'm gonna have you now lay down. So we're gonna assess your abdomen. Okay. Okay, thank you. You can just lift up your shirt for me a little bit. That's good. Okay, so I'm just inspecting right now, and your skin color is appropriate for your race. Skin is intact. I see no lesions, bruising, or scarring. All right, and let me look down real quick. No paracelsus or pulsations, and your contour is flat. Good. If I could just have you lift your head up to your chest, just checking your muscles. Good. So no bulges. You can put your head back down. So no bulges that would indicate a hernia at all, okay? I'm just going to listen to a few bowel sounds now, okay? Perfect. Okay, so your bowel sounds were present in each quadrant. Now I'm just going to listen to your vascular sounds, okay? So I'm going to use the bell on my stethoscope. Check your aorta, your renal, iliac, and then your femoral. Good. So With auscultating nose, I didn't hear any bruising, which is awesome. Okay, and now I'm just gonna palpate lightly. Just let me know if you feel any tenderness or pain. Okay, any?
Oh, no tenderness or pain.
Good, no pain. Okay, and I felt no guarding or masses, or bulges that would indicate a hernia. So since there was no tenderness, bulges, guarding or masses, there's no need for deep palpation. And okay, so I'm gonna palpate your lymph nodes in the inguinal region, and I feel no swelling, and your femoral pulses are present, bilateral +2, and I feel no bulges. Okay, and I'm gonna have you sit back up now. And for the last part exam is just your lower extremities, okay? I'm just gonna keep this right here. Perfect. Okay, so just inspecting your legs. Skin color is appropriate for race. Skin is intact. I see no lesions, bruising or scarring, no vascularity, and your hair distribution is equal. And I see no swelling. So now I'm just gonna palpate down here. Let me know if you feel any tenderness or pain.
No.
Good. Okay, and I felt no bulges either. Check your temperature. Temperature is within normal range bilateral for your legs and feet. Okay, and I'm just gonna check for pitting edema. So I'm just gonna press slightly. Okay, so no edema bilateral. All right, and I'm gonna check 2 pulses now. One is on your heel right here. This is your posterior tibial pulse. All right, pulse is present, bilateral +2. And now your pedal pulse, which is on top of your foot. Okay, and that pulse is present, +2 bilateral. Okay, and then last I'm gonna do the capillary refill, just like I did with your fingers. Just checking your refill on both feet. Okay, and refill is present, bilateral, and refill is less than 2 seconds. Okay, and that ends today's assessment. Do you have any other questions for me at all?